19 days since the visitor from Finland tested positive for COVID, Baguio City remains with up to 3 infections a week. The Finnish woman was carrying the BA.2.12 Omicron subvariant. And if it indeed has spread, City Health Officer Rowena Galpo says COVID cases would have been higher by now.
Yung incubation period na binibilang natin na 14 days ay lumampas na. Sa mga contacts na na-identify natin, sana nag-manifest na rin sila. Kung talagang nag-spread na yun, there could have been indications already na nag-spread. But none, so actually there is no cause for alarm.
The 52-year-old Finnish had 5 close contacts in Baguio City. 3 were tested for COVID, all negative.
They were fully vaccinated. Malaking bagay yon. Nakamask sila.
She also had 9 close contacts in Quezon City and 30 on the plane. The chief of the Philippine Genome Center says there are no signs the woman has infected others.
We can completely discount the possibility, but that is very, very low. There seems to be no onward transmission.
To monitor the exact trend of cases, testing is key, says infectious disease specialist Ron Jean Solante. But testing has declined significantly as COVID cases go down. During the peak of Omicron, more than 500,000 Filipinos were being tested every week. Today, it's just around 100,000 or even less.
Number of tested has gone down because there are also less people that has the symptoms. People who have symptoms and only mild don't go for testing anymore.
He adds, vaccinated people also tend to have shorter duration of symptoms.
That's against the principle of testing. Why will you test when you don't have the symptoms?
But Solante insists samples from infected international travelers should all be checked for variants. Recent DOH guidelines only recommend testing for clinical management and for groups at higher risk of infection, not for asymptomatics. With lower testing, the Philippine Genome Center has fewer samples to run, which means fewer people are being checked for variants. In a statement, the DOH says the observed increase in cases per 100,000 people was small and not sustained and could have not led to any sustained increase in hospital admissions. Caroline Bongkin, CNN Philippines.